Well, one thing I want to say first is that I wish I could share the optimism that I hear, and I'm happy that it is here and that you're expressing
But you're
it.
not optimistic.
But having worked in cancer disparities for almost 3 decades now, I'm discouraged. The cancer death rates are dropping, but the disparities are still there. And it's for many reasons. It happens across the entire spectrum, from prevention to early detection, treatment. There are disparities in different causes, many complex causes of those disparities. But the thing that I think is particularly pertinent to this institution is the fact that the people who have the greatest need have the least opportunity to get the best care. The people who have the greatest need, and in the case of cancer, there are disparities in every of the minority groups, but African Americans bear the greatest burden of cancer. By far, and for every cancer, African Americans have the highest mortality rate for all the common cancers: prostate, breast, lung, colorectal. And I was happy to hear the discussion about slavery, because it took me a long time. This is why it's not so great to be a white person working in diverse communities. It took me a long time to connect the dots. But I see that these disparities are the long shadow of slavery. I see the stress, the oppression, the marginalization, and I particularly see it when I leave my beautiful office at Mission Bay and I drive across the bridge to Oakland to work to do my research in safety net public hospitals and public clinics. The contrast is shocking, and I can never get used to it. And so I've started having conversations with very senior people at this institution and asking, what is our responsibility at UCSF for this right at our doorstep, the third world conditions of hospitals? And I'll just share another sound bite with you. I love Obamacare. I hope nothing happens to it. But the cancer outcomes for Medicaid and in California, Medi-Cal patients are no better than for the uninsured. The cancer outcomes are no better. So access alone is not the answer. It's access to what quality? And another discouraging thought in my mind is that, we have these incredible facilities here that we've raised hundreds of millions of dollars to build this magnificent Mission Bay campus, a monument to biomedical research. But I would argue, and there's data to support this, that as our science advances, disparities will worsen. Right. Because those who have fallen behind will be further behind. The people who participate in the research and will benefit from the advance of precision medicine are the educated, the insured, those who have easy entree to institutions like this. So something has to change. There is nothing in our healthcare or biomedical research institutions that was built from the bottom up to address disparities. Disparities is tagged on, it's worked in, you gotta have grants. It's not an institutional priority. So I would like to see, and I think that if this institution could become a champion for disparities, we would go a long way to diversify our faculty as well, because if we build that, if we built as a central focus of this university attention to disparities, we would have to keep them out because this is where they'd want to be. And I'll just say one more thing. I'm very proud to be affiliated with the UCSF Helen Diller Family Comprehensive Cancer Center because that institution is doing what I would like to see the whole university do. We have a director, a new director, Dr. Alan Ashworth, who came to us a year ago, actually a bench researcher, a distinguished biologist, and said, I want to change cancer in San Francisco. This was startling to us in population health to hear this from a genetics expert. And he has launched an initiative, and he's committed to raising the money to change cancer in San Francisco. This is almost unprecedented. So this is what I think that it could be a win-win-win all the way around for this university. If we could maybe build one less building at Mission Bay. And start something like that campus-wide. It would bring us the diversity, it would help us with disparities, and that would be a wonderful cycle. I could be optimistic.